name is Aaron Gerds, and I'm the Editor-in-Chief of ASH Clinical News. Welcome to this month's From the Desk of. Well, happy February. Happy leap year February. And since there are 3.5% more days in this February compared to last year, we are packing an extra 3.5% of awesomeness into this month's issue of ASH Clinical News. And this is topped off by our feature article looking at the treatment of patients with rare diseases. As the adage goes, when you hear hoofbeats, think about horses, not zebras. But sometimes those horses do turn out to be, in fact, zebras. And what do you do in those situations? Do you call a veterinarian? Do you call a specialist? How do you access the resources that you need to take care of those patients? We think these diseases may be rare, and in fact, NORD defines a rare disorder as a disease or condition that affects fewer than 200,000 Americans. Cumulatively, there are more than 7,000 rare diseases affecting more than 30 million Americans. So even though we call these things rare diseases, collectively, they're kind of common. So how do we access resources? How do we collaborate with specialists in these rare diseases in order to take the best care possible of our patients with hematologic blood disorders that are rare? Really important questions that we plan to take apart and put back together in this month's issue. In addition to that, we have a Blood Beyond Borders looking at the trials and tribulations of running clinical trials in low and middle income nations. And here in North America and in Europe and in Asia, in large parts of Asia, we have lots of resources to conduct clinical trials. But in resource poor areas, how do they get through clinical trials? How do they conduct clinical trials? How do they access the resources that they need to conduct clinical trials with high quality? Because doing trials in these areas are important. We want a totality of data. We want to see how these drugs and these new therapies perform in any population around the world. We also have a Drawing First Blood, looking at the debate between treating iron deficiency with oral or IV iron, the pluses and minuses of each, and the back and forth between that debate. We also have a day in the life of Dr. Kolb, who is the new CEO of the Leukemia and Lymphoma Society. So a real neat pulling back the curtain and kind of seeing inside of what a day is like for Dr. Kolb as he helms the Leukemia and Lymphoma Society. And we have all of our usual news items, including coverage of blood and blood advances publications, as well as our literature scan. So all that and more is in the February issue of ASH Clinical News, and we're delighted to have it come to your inbox. So that's all for this month's From the Desk of. Until next time, keep the blood pumping.